My name is Matt Monroe. I am from Zoll Medical, and I'm here tonight because the church has made the decision to invest in AEDs. And I have to echo everything Cheryl said. I really hope that you never ever have to use these AEDs. But I'd like to just get everybody a little bit more familiar with them should the event arise and should you have to use them at some point in the future. I think generally speaking, people tend to be very fearful of AEDs, but there's really no reason for that. I actually refer to it oftentimes as a doctor in a box. You turn it on and you let it do its job and it will tell you everything that you need to do, okay? I also just want to make it clear that this is not meant to provide any kind of official certification. I'm just really trying to create some awareness and get everybody as a group more comfortable with the AED, okay? Before I get started, I always like to ask, is anybody in the room a professional rescuer or EMT, paramedic, nurse, anything like that? We have a couple over here. We do have a few. All right, great, great. If you guys have anything to add on to this, please feel free to speak up. This is meant to be interactive. So any questions come up along the way, feel free to stop me and ask your questions, and I'll be more than happy to answer any questions that you may have, okay? What I want to talk about first off is cardiac arrest. You know, I always like to talk about what cardiac arrest is and what cardiac arrest isn't. I feel oftentimes people tend to interchange cardiac arrest and a heart attack. They oftentimes kind of relate them as one and the same, but they're really not. First of all, cardiac arrest, I often like to describe it as an electrical problem with the heart. The heart receives electrical impulses, and that's what allows the heart to pump and pump blood throughout the body and ultimately up to the brain. And when you have a cardiac arrest, really what happens is it's not receiving the proper electrical impulses that it needs to pump blood all the way throughout the body and ultimately up to the brain. And when that happens, when an individual suffers cardiac arrest, they will fall to the ground and be ultimately unconscious. They will not be able to respond to you. They will not be breathing. Oftentimes they will turn maybe various shades of gray or blue because, again, the blood is not pumping all throughout the body the way that it should. Okay? But the important factor here is they're not going to be able to communicate to you. So if somebody suddenly falls to the ground of cardiac arrest and you go up to them and you're trying to get a pulse or you're shaking them and you're trying to get them to respond to you, if you get nothing back, that's when you need to yell to somebody to call 911, yell to an individual to go get the AED, and later on we're going to take a walk and go see exactly where they're located. It's very important that everybody knows where they're located, so it's second nature. So if something were to happen without thinking, you can quickly get to that AED and then back to the individual, okay? And then the other thing that's really super important when it comes to cardiac arrest, it's CPR, okay? High quality CPR, and I'll get into exactly what that is. But that's kind of at a high level what cardiac arrest is. You know, when you talk about a heart attack, I mentioned that cardiac arrest is more of an electrical problem with the heart. But yeah, so as I mentioned, cardiac arrest is an electrical problem with the heart. As it relates to heart attack, I often will say that a heart attack is more of a plumbing problem with the heart, where the blood is not able to flow freely as it should to and from the heart. But the big difference there is with a heart attack, oftentimes an individual will be able to communicate to you and talk to you. They may be sweating profusely. They may complain of pains in their upper arm and their neck or in their shoulder. But again, the important thing is they can communicate to you. I always tell the story how my father-in-law, it was well over a decade ago now, he had a heart attack and he actually drove himself to the hospital. Okay? Cardiac arrest, that's not going to happen. Okay? Again, the individual is going to fall to the ground and be completely unresponsive, and that's when you want to get the AED. Okay? Any questions about that? Everybody pretty good there? Okay. So as it relates to the AED, one of the things I mentioned that's very important with cardiac arrest is CPR. Everybody in this room, I'm sure, is familiar with Damar Hamlin of the Buffalo Bills at this point. You know, that's very top of mind with everybody, especially here in New York and the farther west and the closer to Buffalo you get, everybody's familiar with that. And thankfully, he's still with us today. I just saw on the news this week that he's back on the practice field, so that's absolutely wonderful and certainly amazing to see that. But one of the reasons that he's here with us today is because of how quickly they were able to react to him. They quickly got his face mask off. They very quickly got his shoulder pads off. They got the professionals on the field very quickly. As everybody knows at this point, the team had a plan in place. They reacted. They knew exactly what to do. Time is of the essence when it comes to cardiac arrest. And statistics and studies show that with every minute that passes when somebody suffers cardiac arrest, every minute that passes, your chance of survival is reduced by 10%. Okay? So that's why it's of the utmost importance to be able to call 911 as soon as possible, grab that AED, and start CPR. And when you do CPR, according to the American Heart Association, there's a few factors that go into what they call high-quality CPR. One of them is when you do CPR, you need to do it continuously for 2 minutes straight with very minimal or no interruptions, okay? Another thing is when you do CPR, you have to do compressions at a rate of about 100 to 120 compressions per minute. So a very common thing that people may have heard of in the past is when you do your compressions, you should sing "Staying Alive" in your head and push to the beat of "Staying Alive." I've also heard some other people reference Baby Shark, that children's song, Baby Shark, do-do, do-do, do-do. So, you know, just get that song in your head and hum to that and push to the beat of that. With Zoll AEDs, what's unique about Zoll AEDs is that Zoll is the only manufacturer of AEDs out there that actually walk you through in real time how to perform high quality CPR. So when it comes to your rate of compressions, when I turn this unit on in a few minutes, you're going to hear a metronome. And that metronome is going to guide you to that rate of 100 to 120 compressions per minute. So when you do your compressions, you need to push to the same beat as the metronome that you hear on that unit. Okay? Another...
Just ask a quick question.
Yeah.
Say like you start it and you really can't sustain it. Someone else can...
Absolutely. Absolutely. Hopefully you're not alone in this situation and you have another person within the parish that can help you. And if you need to tag out, by all means, certainly tag out and let the next person jump in and you guys can rotate and kind of take shifts.
And make sure that,
Yep.
you know, that they wouldn't do any harm if you simultaneously, you know, if you just really couldn't keep it up any longer than somebody else.
Yep. And you know what? You may not be able to, because the other factor that I didn't mention yet is when you do your compressions, you should be doing them at a depth of about 2 to 2.4 inches on the chest. Okay? So when you think about that, you're pushing pretty deep on a human's chest. So when you're doing that, you're going to hear bones breaking, cartilage breaking. It's not going to sound very pretty. Okay? But I want to also let everybody know that, you know, people are very fearful when you say that because they're thinking, oh my gosh, I don't want to hurt this person. And thank you very much. I always try to be careful about that because I don't want to sound insensitive, but the person is dead already. So the alternative is, you know, they can go home to their family or they cannot go home to their family. And I'm sure they'd rather go home to their family with a few broken ribs, of course, right? So you're thinking to yourself, well, geez, how am I going to know how deep I'm pushing on the person's chest? Well, with Zoll AEDs, and you'll see when I turn this on shortly, it shows you how deep you're pushing on the chest. There's an actual bar gauge right on the screen of the AED that shows you the depth. There's 2 little hash marks, and the bar gauge is pink when you aren't pushing quite deep enough. When you get to the right depth, the bar gauge turns purple, indicating that you're at the right depth. And it also has text prompts on the screen, so if it's a noisy situation, it'll be a very panicky situation. There's probably going to be, you know, people reacting in a panic state of mind, so it could be noisy. But there are text prompts on the screen as well as voice prompts that tell you exactly what to do. It might tell you to push harder, and if you push harder and you get to that proper depth, the unit then also tells you good compressions, giving you positive affirmation that you're at the right depth.
This assumes that you already put the pads on the patient because the machine has to know information. So
Exactly.
just turning it on is not going to help you.
Right. Well, you'll see shortly when you turn it on, it's going to walk you through all the different steps in the process. Okay. And I'll show you right on the unit here. You're going to grab the AED, but you'll notice, so if somebody suffers cardiac arrest, these pads need to be applied right to the individual's bare chest. Okay. There are scissors that are included right in the pad package, so you can use these scissors to cut open their clothing and expose their bare chest. If it's a female, the bra also would need to be cut off. And the nice thing is, right on this pad package, it's going to be difficult for everybody to see, but there's a diagram right on the pad package that shows you exactly how the pads are to be applied to the individual. It's also, the same pictograph is also right on the pads themselves. So you can see exactly the way that the pad should be applied to the individual.
A little razor in there too.
Yes, there is. So also attached in here is there's a little bag in the back. There's a razor in here, so if you have a male who has a lot of chest hair, you want to clean up that chest hair. You don't have to do it to perfection, but you just want to clean it up quickly, just enough so that the pads make good contact with the individual's chest. Okay, so right in here there is a razor to be able to do that. There are also wipes, so if the individual is sweating quite a bit, and they may very well be, you want to take those pads and wipe the excess perspiration off of them. Again, the whole reason for doing that, so you get good contact with the pads to the individual's chest. Okay, so everything you would need for that is right in here. All right, any questions about that? Yes.
Just give me an idea, is it either side of the chest the pads go?
Yes,
In
on
the diagram, but I just want.
yep on an adult, it may actually be easier to see on this. This is how the pads are applied on an adult. Okay.
Upper right, lower left.
Upper right, lower left. Essentially what you're doing is ultimately you're sandwiching the heart. Because if the unit actually calls for a shock, what's going to happen is the shock will go from one pad through the heart to the other pad and then back again. That's how it works. And now, here, I'm going to blow everybody's mind here. What's unique about this AED and these pads is that you have one set of pads for both adult and pediatric patients. Okay, so what is a pediatric patient? The American Heart Association defines that by an individual that is 8 years old or less, or 55 pounds or less. So if you have a child patient, again, you're going to use the same exact pads, and what's going to happen is these pads here will be placed on the child's front, and the pad that you would put on an adult patient that go on the side would then go on their back. Okay? Again, what we're doing is we're sandwiching the heart so that the shock will go from one pad through their chest, through the heart, to the other in their back, and then back again. Okay?
So in that same position, only on the back?
The blue pad would go on the back.
Okay.
Correct. Yep. Because the person's 55 pounds or smaller, so there's not enough real estate on their chest to be able to apply them that way. So that's why it gets applied one on the back.
What if you have a smaller adult that's over 55 pounds, but the way that the pads are, they're too close
Like a slide
together?
pad.
A little tiny.
We have some frail little ladies in our church.
Yep, yep. So I would say if they're over 55 pounds, I'm just going to go by what the American Heart Association says, and I would apply them just as you see on an adult. Okay? What the unit will ask you, and again, you'll see this when I turn it on, the unit needs to know if you have an adult or a child patient. So it'll say, if patient is a child, press the child button. And right on the AED, right on the front, there is a button here that indicates it's a child. And then you push that if in fact you have a pediatric patient. Okay?
Where was it again?
Right on the front.
Okay.
And everything is going to be on the screen. It's going to be very difficult for the whole group to see that, unfortunately. But everything will be right on the screen. There's color pictures right on the screen, so you can see exactly what you need to do. Again, you know, if something were to happen 2 years from now, you guys are probably going to forget that I was even here. Especially because it's going to be, you know, a member of the congregation, probably a close friend, a loved one, a family member, who knows. And you're going to be in a panic state. Everything that I said tonight is most likely going to go out of your head. But if you just remain calm and just simply follow the instructions that the unit gives you step by step, you'll do just fine. Okay? Any questions? These are all good questions so far, by the way. If there's no questions, I'm going to go ahead and turn this guy on and do a little demonstration for everybody. All right? So I guess I'll face this way. So these AEDs that are upstairs, these pads, these electrodes are going to be right in the back of the unit, so the pads will be right there for you, ready to be used. And the nice thing is, I tell everybody, because we do have some professional rescuers in this room, this unit is designed to keep pace with you, the rescuer, no matter if you're skilled or never done CPR before in your life, okay? It knows where you are in the rescue and it keeps pace with you. So if you have somebody that really doesn't know what they're doing, you'll see when I turn this on, this is gonna walk you through very simple, basic steps, and you're all gonna be sitting here thinking, geez, this thing isn't moving along very fast, okay? I'm gonna do that on purpose so that you can see, again, in a panic state, everything seems very common sense and simple to you now, but if you're in a panic state, it might not seem common sense to open up that pad package, okay? It might not seem common sense to cut and expose the person's bare chest. But if you get the professional rescuer that knows exactly what they're doing, they cut and expose the person's bare chest, they get those pads out, they apply them right away, the unit is gonna know that, and it will skip through the first few steps, and it'll get right to the analysis mode, all right? Something else I want to bring up to everybody, I'm going to demonstrate two different scenarios here. One scenario is the unit will deliver a shock on its own. You guys bought automatic AEDs. What automatic AEDs means is if the unit does an analysis of the individual and it detects a shockable rhythm within the heart, it will deliver the shock on its own, and you'll see that. But statistics show that only 50% of the time will the unit actually call for a shock, okay? But 100% of the time, everybody's going to have to do high-quality CPR, and don't worry, this unit will walk you through exactly how to do that, all right? There has to be a shockable rhythm within the heart. I think everybody, you know, when they think of cardiac arrest, oftentimes we think of the doctor in the TV shows, right? Where you have the patient laying on the table, and all of a sudden, there's a flat line on the screen, the doctor comes running in, he grabs the paddles, he rubs them together, yells clear, and hits the patient. Well, that's TV, it's not real. You know, if the heart is in asystole and there is no beat whatsoever, the unit will not call for a shock. That's where it needs you to perform CPR and try to kickstart that heart a little bit. And then on the next analysis, hopefully it'll be able to deliver a shock. All right? But only 50% of the time will that be the case. 100% of the time, you're going to have to do CPR. And today, the national average EMS response time is about 7 to 14 minutes. That's probably gotten a little bit longer. I was just at an EMS agency today, and they're having a hard time getting people to come work for them. So the 7 to 14 minutes, probably more like maybe 9 to 17 minutes in this day and age. So you're going to have to do CPR, and you could be doing it for a long time. And to your point, you're probably going to get tired, and you're probably going to need somebody to help you out because this is a very tiring process, as I'm sure a few of you in the room are aware. When you're pushing 2 to 2.4 inches deep on that chest, that's going to cause, it's a lot of effort on your part, and it's going to wear you down pretty quickly, okay? So I'm going to turn this on, and I'm going to show everybody how it reacts whenever there's not a shock, and then I'm going to turn it off, and I'm going to show how it delivers the shock on its own, all right? Again, I apologize that people won't be able to see the screen.
Automatic defibrillator. Stay calm. Check responsiveness.
Are you okay?
Call for help. If patient is a child, press child button. Remove pad package. Cut or tear clothing to expose patient's bare chest. Cut or tear clothing to expose patient's bare chest.
That's where you
Open
grab these
pad
scissors.
package.
You're going to take the pad package here, you're going to open it up, you're going to pull the pads out. Pads are right inside.
Attach pads to patient's bare chest.
So this is where it wants you to put the pads on the individual.
Attach pads to patient's bare chest.
Now, it's not going to go past that part until the pads are attached. I haven't turned the mannequin on yet, so the unit believes that the pads are not on the individual.
Attach pads to patient's bare chest.
So I'm going to turn this on now, and that's going to simulate the pads being attached.
Don't touch patient. Analyzing.
Now it's looking for that shockable rhythm. So this is where you clear the area and stand back, make sure nobody's
Don't touch
touching the
patient.
individual.
Analyzing. No shock advised. Start CPR. Push to match the tone.
So can everybody hear the tone? I'm having
Start
some microphone
CPR.
difficulties. I haven't started CPR yet. The unit knows that. There's also a countdown timer on here that shows you how long you have till the
Start
next analysis.
CPR.
All right? That can be helpful. To somebody with no medical background, you're thinking, oh God, I don't know if I can do this much longer. But if you look at that countdown timer and you see you only have
Start
20
CPR.
seconds left, I think psychologically you'll be like, I can do it for 20 more seconds, and it kind of pushes you through. Now, I'm not pushing hard enough right now.
Push harder. Stop CPR.
So I had it set up for a minute.
Change battery.
Uh-oh.
Don't touch patient.
That's not good.
Unit powering off.
So for demonstration purposes, I have it set up for a minute. You know, for one, it'll take a long time if we sit here for 2 minutes, and if I do it for 2 minutes, there's a chance you guys might have to use it on me, and we don't want that tonight. But that kind of gives you an idea how it works. Hopefully everybody had a chance to hear that metronome. And again, right on the screen, there was, I can probably show you folks sitting over here. Right on that screen, there is the bar gauge. That is pink if you're not going deep enough, and then it'll turn purple when you get to the right depth, okay? So I'm gonna change this up a little bit, and I'm gonna set it to a shockable rhythm this time around. And I'm gonna turn this on right away, which is basically symbolizing having the pads attached immediately. And you'll notice how it's gonna skip through those first steps that it went through initially when I first turned this on, and it get right to the analysis mode, all right?
Unit okay. Change battery. Automatic defibrillator. If patient is a
So the
child, press child
The
button.
battery's getting low, but it's still working through the whole process.
Don't touch patient. Analyzing.
So see how it skipped all those initial steps that it went through before, open pad package, all that stuff?
Don't touch
So
patient.
it keeps pace with you, the
Analyzing.
rescuer.
Don't touch patient. Shock will be delivered in 3, 2, 1. Shock delivered. Start CPR.
So it did that all on its
Push
own.
to match the tone.
It delivered the shock. You didn't have to do anything. It detected that it needed to be delivered, and it did it indicating that beeping noise. All right?
Start CPR.
Can you guys over here see that bar gauge?
Push harder.
So I'm not going deep enough. It says push harder.
Harder. Good compressions.
Then once I get to the right depth, it says good compressions. You see that the purple bar gauge? That indicates I'm at the right
Battery.
depth. But over time, I'm going to tire and not push as
Push
hard.
harder.
And it knows that.
Push harder. Good compressions.
So you get the positive affirmation that you're doing it correctly, and then all you have to do is just keep doing it right to the metronome.
Stop CPR.
So now it's going to do another
Don't
analysis.
touch patient. Analyzing. Unit powering off.
So again, the nice thing is, like I mentioned when I first started, it's really like a doctor in a box. You can see how it walked you through all the very simple steps. Grab the pad package, open the pad package, cut and expose the patient's bare chest, apply the pads, and again, the pads show you exactly how everything should be applied. There's a pictograph right on the pads that shows you how the pads are to be applied. So all these things, it's all right there for you. You just have to do your very best. It's easier said than done, but do your very best to remain calm, and the unit will just walk you through everything that you need to do. Okay?
Does it actually, excuse me, does it actually say where to put your hands for the compressions? I see the little sticker, but is there like a little sticker for that too, or?
It doesn't verbally tell you where to put it, but you can see there's an indicator right on the pads that has a picture of hands on it, so you can see where your hands should be applied. Okay? So The pad will go essentially right on the upper chest. And that puck, as we call it, essentially goes right in the middle, right on the individual sternum, essentially right between their nipples, and that's where your hands are placed, all right? And when you place your hands on the individual's chest, the easiest way to do it is to put your palm down, put your other hand right on top, interlock your fingers, and keep your elbows straight, and use your back for leverage, okay? It makes it a lot easier to do it that way. But the picture's right on here, so you should be able to tell exactly where you should place them and then where your hand should go as well. Okay?
So back to the battery. Are they battery powered and how long do the batteries last?
Yeah, don't let that scare you. The batteries and the pads last 5 years.
Okay.
Okay? So for 5 years, you're not going to have to worry about it. And the unit does its own little self-maintenance check. All right? Again, it's going to be tough for people to see. And the battery's getting low, so it's not on this one. But there's a window right here. Okay? And in this window, there's a green check mark normally. But the battery's bad. So that green check mark tells you that the unit is rescue ready, and you'll be able to see it on the units that you have upstairs. The unit will do a weekly self-test, and every week on its own, it checks the pads, the batteries, and all the internal circuitry. As long as it passes its own little self-test, you'll see that green check mark there. If it fails, like right now, the battery is low, and when that happens, this window becomes blank. There's nothing in it. There's no green check mark, and the unit will start beeping at you. You might have heard it a second ago, it beeped. So similar to when your smoke alarm batteries start to die, the smoke alarm beeps at you, the AED does the same thing, okay? So the lesson here is, folks, if you hear an AED upstairs beeping like that, something is wrong. It's probably the pads and batteries have expired.
Call Tom Currency.
And call Tom. Tom will take care of it, I guess. But I've heard too many horror stories. I was at a hockey rink about 4 months ago or so, and they needed to get a new AED, and I saw that they had a cabinet on the wall when I walked in, but there was no AED in there. So I said to the individual I was working with, I said, hey, where's your AED? Did you guys have to use it? And he said, no, we had to throw it in the back, and it's in somebody's office in a drawer. I said, why? He said, because it was beeping, and it wouldn't stop beeping. So we threw it in the drawer, and then we still could hear the beeping, so we wrapped it up in a towel and just shut the drawer. So I pulled the unit out, and I looked, and the pads had expired 6 months prior. And that's all it was. They just needed new pads. There was nothing really wrong with the AED. It just needed new pads. So if you hear a unit beeping, that's what it is. 9 out of 10 times, it's the pads or batteries.